Case report, Nelson Mandela, emergency admission and treatment protocol. Patient, Mr. Nelson Mandela. Age, 94. Date of admission, a fictional date. Hospital, Pretoria, Central Medical Hospital. Medical record, Number, PCM 001 205. Emergency admission. And initial assessment, Mr. Nelson Mandela was received in the emergency room at 0840 hours following a severe traumatic episode. He was non-responsive and bleeding from the forehead. Triage nurse, Ms. Lydia Mokoena, RN, immediately initiated the Advanced Trauma Life Support ATLS protocol. Attending emergency physician, Dr. Johan Botha, emergency medicine specialist. Initial diagnostics ordered. MRI brain to assess for intracranial hemorrhage or neoplasms. CT scan, head and chest, to evaluate head trauma and thoracic integrity. Abdominal ultrasound, rule out internal bleeding. Digital X-ray, chest and extremities. All diagnostics were performed within the first hour of arrival. First aid was administered, including hemostatic bandaging and IV fluids, Ringer's lactate. Diagnostic findings: MRI, brain, presence of a midline shifting tumor in the left temporal lobe, 3.6 km diameter. CT scan, no acute hemorrhage, tumor, visible. Ultrasound and X-ray, normal abdominal and skeletal profile. Cardiac status, later evaluation. Severe aortic valve stenosis with reduced horn ejection fraction, EF 32%. Neurosurgical intervention, lead neurosurgeon, Dr. Nkosazana Dlamini, MBCHB. FCS neuro, anesthesiologist, Dr. Frederick Lau. Scrub nurse, Ms. Sibongjel Kumalo. Procedure, left temporal craniotomy and tumor resection. Duration 5 hours. Outcome, tumor successfully excised. Specimen sent to pathology. Patient shifted to recovery room 1. Post-neurosurgical monitoring. Intensivist, Dr. Andrew Matlala. Patient was under observation in a special post-op suite. On day 2, cardiac irregularities were noted. ECG and echocardiogram confirmed severe aortic valve pathology. Cardiac surgical procedure, led cardiac surgeon, Dr. Aisha Khan, MBBS, FRCS CTV. Cardiologist, Dr. Sibusiso Malongo. Perfusionist, Mr. Daniel Botha. Anesthesia team, Dr. Rachel Stein and team. Procedure, open heart surgery. Aortic valve replacement. Duration, 6 hours. Post-surgery care. Shifted to recovery room 2. Then moved to ICU, bed 4 intensive care, unit monitoring. Chief ICU nurse, Ms. Thandiwe Mbatha. Assigned nurses, 24/7. Nurse Peter Moyo, RN. Nurse Linda Masuku, RN. Nurse Claire Van Royen, RN. Nurse Sifo Dladla, RN. Vital parameters monitored continuously. IV fluids, vasopressors, antibiotics, and high-flow oxygen were administered. Multiple IV drips and antibiotic regimens were rotated due to poor initial response. Complication management. Despite optimal medical care, Mr. Mandela exhibited delayed recovery. A multidisciplinary board meeting was held by Dr. Aisha Khan, cardiothoracic surgery, Dr. Nkosazana Dlamini, neurosurgery, Dr. Mlongo, cardiology, Dr. Matlala, intensive care, Dr. Ruth Zulu, hematology. Findings: hemoglobin levels critically low. Immediate blood transfusion protocol initiated. 6 units of packed RBCs transfused over 48 hours. Public response and security measures. During ICU stay, large crowds of supporters, estimated over 2 million, gathered outside the hospital. Hospital administration, led by Mr. Themba Radebi, requested law enforcement intervention for crowd control. SAPS was deployed for public order and perimeter security. Final recovery and discharge. On day 21 post-admission, clinical signs stabilized. He was shifted to a general ward for rehabilitation after a total of 30 days in the hospital. Vitals normalized. Neurostatus, alert and oriented. Cardiac status, stable, EF, 55%. Discharge summary prepared by Dr. Andrew Matlala. Transportation. Patient was discharged in a fully equipped hospital ambulance. Before leaving, Mr. Mandela expressed deep gratitude to the entire medical team, thanking each department for their relentless care and dedication. If he not given a special medical care with transfusion of more blood bags and intravenous drip in his vein, recovery of Mandela was nearly very difficult. This case highlights the complexity of managing multi-organ critical conditions, including neuro-oncology, cardiothoracic emergencies, and post-op ICU care in a geriatric patient. The interdisciplinary coordination and critical decision-making were pivotal in Mr. Mandela's survival and recovery. After recovery and able to walk on his feet, Mr. Nelson Mandela thanked the team of doctors of the hospital and went away on an ambulance especially arranged for him by the hospital administration.